Okay, so my name is Amy. I am the founder and manager of Forever Angels. So we initially opened in 2006 in Tanzania as a baby home. I was asked by social welfare to open a baby home because unfortunately in Tanzania, maternal mortality is very high, one of the highest in the world. 20 women die every single day in childbirth or shortly after childbirth. So that basically leaves 8,000 babies a year at risk of malnutrition and death. Before we opened, those babies basically were kept in the local government hospital, and they weren't fed and they died of malnutrition because the cost of formula milk is just so high. So we opened Forever Angels with a goal to caring for those children just temporarily until they can either be returned home to their biological families or they can be adopted into new families. So that was the knee-jerk reaction back in those days from social welfare, that if a mother dies in childbirth, the baby will be put in an orphanage and then returned home when it's weaned and it's healthy. So that's what we did. We opened in 2006. We opened for about 20 children, although within about 6 months we had 60 babies. The need was really high. Not only orphan babies, but also abandoned. There's many abandoned babies in Tanzania. So I believe we did a really good job of what we were doing. We have amazing Tanzanian staff, and they gave really great care to the children. We have an on-site preschool, a sensory room, and yeah, we were called the best orphanage in Tanzania by the Department of Social Welfare, and we had a really high success rate of reunification. So 82% of our children left us to live in either adoptive families or back to their biological families. Over the years, we've cared for 465 children, but we did come to the realization that sometimes, in fact, in quite a lot of cases, the only barrier that prevents grandmothers, aunts, relatives from caring for an orphan baby is milk and the high cost of milk. So around 2012, we started just ad hoc giving some of these grandmothers who'd lost their daughter and were raising a grandchild. We started giving them weekly formula milk, and they would take the milk, give it to their babies, and we would see really good progress. The babies were developing really well, and we thought, okay, pat on the back, this works, this is good. And so we did it for about 30 or 40 babies, I'd say, just ad hoc. They came whenever they ran out of milk. There was no real structure to it. And then we started to visit them like 6 months after they finished their milk. And unfortunately, we saw some malnourished children. And we got to the realization that we weren't getting to the heart of the issue. We weren't solving the actual problem, which was poverty within the family. So the baby may have been well nourished with the milk, but as soon as it needed solid food, the family was not able to provide that. So we started doing business creation for the female caregivers in the family. So they'd come every week to collect milk. We'd build really good relationships with them, and over like 4 to 6 months, we'd work out with them what business they could do, what they had skills in, what was a need in their local area. And we set these grandmothers up in business. And again, that worked really well. And we gave ourselves a pat on the back and we thought, okay, this model works now. And then sadly, one of the babies that had been raised really well by the grandmothers, and they'd done so brilliantly, and they were 2 years old and they were healthy, happy toddlers. We got a call to say they died from diarrhea. And we were like, this is ridiculous. This is preventative. This is so easy to prevent. Like, what can we do? So we decided to build a training element into our program. So it became less ad hoc and much more structured. So instead of coming whenever they finish their milk, all families would come on a Tuesday morning. They'd collect milk, would weigh the babies, and then my brilliant staff in Tanzania did preventative health training on things like malaria, diarrhea, child development, food and nutrition, water safety, and that program's grown over time from things our beneficiaries have requested. And it came together as a holistic program, which we named Maisha Matters, and that means life matters. And that started properly in 2014. And then since then, we decided to create a social franchise. We reinvented the wheel so many times until we got to this model that really worked. We thought, you know what, it works, let's share it. And so we've partnered with some other really great NGOs across Tanzania, in Geita, Dar, Arusha, Tenga, and taught them how to run Maisha Matters. So they come for training with our staff, and we've got manuals and training programs and operations manuals, and we've got a whole package now. And between the 5 programs running Maisha Matters now, we have supported over 2,093 babies, which basically means 2,093 babies didn't go into an orphanage and are now alive and healthy and nourished because of our work. And overall, that's 10,600 beneficiaries. So that includes the baby and the grandparents, as well as any siblings in the household. And the impact has just been huge. Like, the positives of doing this program alongside Forever Angels is we can help just many more children. So over 17 years, Forever Angels, the baby home, supported 400-ish children, but the Maisha Matters program can help so many more, like over 2,000. It's much cheaper. It's much cheaper to keep children in their own homes and to empower and build whole families rather than keep a baby in an orphanage. So it is a no-brainer. And the impact has been huge. We've seen huge reduction in malnutrition and hunger amongst babies, and that's led to a big reduction in infant mortality in our area. We've seen huge promotion of gender equality because we're empowering women through business, reduction in malaria and diarrhea disease because of the training we do, and basically increase the capacity of families to be able to care for orphan babies in their own homes and them never having to enter an orphanage, as well as increased education, not just to the beneficiaries are delivering to, but that education gets spread amongst their communities as well. But the biggest thing that we saw was a reduction in the number of babies being admitted to Forever Angels. So whereas we used to have 60 at any time, because we were now helping these same babies, but in their own homes, they never needed to be admitted. And the numbers reduced to around 20 to 25. And that gave us the ability in 2022 in November to transition away from the orphanage and move into family style homes, into family style care. So we used to have one baby home building with 60 babies. And because that number reduced, we now have 4 family homes on our site with a mum and an auntie in each house, and up to 8 children. So at the moment, they've all got about 5 or 6 children, but the capacity is 8. And the goal is still the same. The goal is still that all of these children will be adopted, or they'll return home to biological families. But whilst they're with us, they live in a family. And we've seen so much positive impact from this. So there's less illness amongst the children because they're not living in such big groups. They're just generally healthier, as are the staff. Actually, we have much less staff absence. Really strong attachments have been formed between the children and their mamas in the house. And statistically, we know that children who are able to form a strong attachment is able to transfer that as long as it's formed before the age of 5. So we have really strong belief that these attachments will continue, and they'll be able to form bonds with relatives or adopted families. We've seen improved language and just basically cognitive development along the children because the mamas know exactly where they're at and can read the same stories or move up from different counting or whatever they're doing one day, they know what they can do the next day. Whereas before, when they had lots of different caregivers, that was quite difficult to monitor. We're also seeing really appropriate responses to strangers. Before, when we had a baby home and any random person would walk in, the children would go to them happily and they'd be quite secure being picked up by a stranger. Whereas now, if I walk into one of the houses, the children cry and they run and hide behind their mamas. While it's sad for me, it's actually really, really positive, and it's really what we wanted to see. So, and as you can see on the right, Forever Angels and Maisha Matters is really linked. So we basically get a referral from social welfare, and then we decide which program it will go into. So if there is a relative alive that can care for that child, they will go to our Maisha Matters program, and they'll receive nutrition and training and crisis support, and the family will receive business empowerment. So they never are admitted. Whereas if they're admitted to Forever Angels because they've got no relatives and they're abandoned children, we got one just this morning, then the they're put into one of our family homes and they're there for as short time as possible while we work with social welfare to find relatives or find adoptive families for the children. So you can see the bottom of the graph, the green is just the numbers we've cared for in Forever Angels, and the pink is the numbers that we've been able to care for because of the My Show Matters program. And obviously in an ideal world, there would be no orphanages, there'd be no institutions, but we don't live in an ideal world. There's orphanages all over the world. We even have them in the UK. We just call them group homes and pretend we don't have them. And whilst, you know, lots of people are stating we should close all orphanages, and, you know, there's lots of things like that being spread around, that is absolutely an ideal. But it's also very difficult. You know, we have babies referred to us we've got one this morning who was abandoned in a farm. There is currently nowhere in our city for that child to go. So for us, this is the best option. They're in a family style home. They're monitored very carefully by our nurses, by social welfare. They're living very, very happy, fulfilling lives until it is time that they can be put into a permanent family. So yeah, the model works really, really well. And we'd love to see it spread more. So we did a pause over COVID. We didn't really grow My Show Matters because of money, finances, the fact that we couldn't go out to do training because of COVID. But obviously now that's behind us, then we really would love to share our model with other people. And yeah, would like to see it grow further. So
amazing, thank you. I think it's really